more important points for NEET PG. First of all, peripheral blood smear. Peripheral blood smear. First, Hinge bodies. Hinge body. Hinge. 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 Pronounced like hinge. Hinge. So G6 PD deficiency. Hinge. Next, Howell Jolly bodies. Howell Jolly body. Howell Jolly body mostly seen in post-splenectomy patient. Post-splenectomy patient. Post-splenectomy patient. And if we draw a picture, it is looks like this is Hinge body. And Howell Jolly body is this is. So how can I remember it? In case of Howell Jolly body, Jolly means happy. So single people are happy. Single. And next, just imagine a thalassemia patient or in a splenomegaly patient after splenectomy, he feels happy. So a thalassemia patient with splenomegaly after splenectomy feels happy. So it is a tricks. Next, next is Barcel and Sparcel. Barcel and Sparcel. And Sparcel. BU. So in barn patient, U in uremia. In barn patient and in uremia. It is also echinocytes. Echinocytes. Parcel seen in A beta lipoproteinemia. A beta lipoproteinemia. A beta lipoproteinemia. Par P SP. So it has spiny points. Spine present. Spiny points present. If I draw a picture, it looks like the spiny points. So it is spiny points. It is parcel and parcel. It is smooth. It is smooth. That is bar cell. Next, next, we are going to discuss some tricks to solve the questions which are associated with foods. First, association associated with foods. This is a chart. So, first, erythromycin, foods erythromycin or azithromycin associated with hypertrophic hypertrophic pyloric stenosis. So, if in a MCQ or in a question we have got the history of ingestion of erythromycin or azithromycin in mothers, so it causes hypertrophic pyloric stenosis. Next, Jowar. It causes Genu valgum. How we can remember it is Jowar. If we think it is like a Januar, everyone gets fear, and valgum, vulgar means bad thing. So it is the tricks. What is the trick? Jowar, associated with Jowar, Genu valgum occurs. Jowar, if we think it's a Januar, it is fearful thing, and valgum, it is a vulgar, so bad. So Jowar causes Genu valgum. Next, next is rotavirus vaccine. Rotavirus vaccine. Rotavirus vaccine associated with into susception. Rotavirus vaccine associated with into susception. Next, OCP, oral contraceptive pill. Oral contraceptive pill. It is associated with hepatic adenoma. Hepatic adenoma. Here is an important point. OCP not a risk factor for HCC, hepatocellular carcinoma. Hepatocellular carcinoma. So OCP cause hepatic adenoma, but not a risk factor for hepatocellular carcinoma. Next, next is smoking. Smoking cause squamous metaplasia of lactiferous duct. Squamous metaplasia of lactiferous duct, also called Josca's disease. Also called Josca's disease. Smoking, squamous, Josca's. So, smoking, squamous metaplasia of lactiferous duct is Josca's disease. Next, if we got some history like hot liquid ingestion, spicy food, or alcohol, hot liquids, spicy food, alcohol. It is associated with rosacea. It is associated with rosacea. So next, various types of deficiency associated with foods. Deficiency associated with food. First, heated cow milk. Cow milk. Vitamin C deficiency. So, vitamin C deficiency in heated cow milk. Next, breast milk. Breast milk. Vitamin K, vitamin D deficiency. Next, maize and jowar. B3 deficiency. B3 deficiency. Next, polished rice, vitamin B1 deficiency. How you can remember it? In Bengal, rice is main or number one food. So, vitamin B1 deficiency in polished rice. Next, some genes as important genes association with various disease. Genes association. First, hemochromatosis. Hemochromatosis associated with HFE gene. Hemochromatosis associated with HFE gene. Next, Menkes disease. Menkes disease. It is ATP7A gene. Next, Wilson disease. ATP7B gene. MW looks like same or resembles MW, but M comes first. So it goes for A, W goes for B. And here is the important point regarding ATP7B gene mutation. ATP7B gene mutation is loss of function mutation. Loss of function mutation. ATP7B gene is loss of function mutation. How we can remember it? B means second letter. B second letter. So it is a loser. Second letter, it is a loser. So it's a trick. Next. Next is Dubin Johnson syndrome. Dubin Johnson syndrome associated with MRP2 gene mutation. MRP2 gene mutation. Two, do, two, two. So it is MRP2 gene mutation. Next, we all know oxygen therapy is very important therapy for patients. Or but in case of some disease or some conditions, oxygen therapy should not be given. Oxygen therapy should not be given. Which conditions? Number one, chronic bronchitis. Number two, paraquat poisoning. Paraquat poisoning and oxygen therapy not useful in central respiratory depression. Central respiratory depression. Central respiratory depression. O2 therapy should not be given in chronic bronchitis, paraquat poisoning, and O2 therapy not useful in central respiratory depression. Next, here is some important point. Crystals in urine. Crystals in urine. There are a lot of MCQs came from this topics. Crystals in urine. First, monohydrate. There is 2O. If we linked this 2O, it looks like dumbbell. So it is dumbbell set. Next, cysteine. Y looks like G. So hexagonal shape. Next, struvite. There is 2T. So it is coffin lead to F. This is coffin lead. Next, next is oxalate. Oxalate. X. So it is looks like X. So it is envelope set. Envelope. So monohydrate 2O. If we connect this 2O, it looks like dumbbell. Cysteine Y looks like G. Hexagonal shape. Struvite. Coffin lead shape. There is 2T. There is 2F. Oxalate X. So it is envelope shape. It is envelope shape. Next, important urinary cast. Urinary casts. First, hyaline cast. First, hyaline cast. Seen in AKI, acute kidney injury. 2. Broad or waxy cast. Seen in chronic kidney disease. How you can remember it? Broad means big, chronic, it also long or big. So it's a trick. Broadcast or waxy cast seen in CKD. Next, RBC cast. RBC cast seen in acute glomerulonephritis. RBC cast seen in acute glomerulonephritis. Next, WBC cast seen in pyelonephritis. Pyelonephritis. Next, Mardi or epithelial cast. Mardi or epithelial cast seen in acute tubular necrosis. Acute tubular necrosis. How you can remember it? What is the trick? Mud, it is bad thing, or it is a necrosis also is a bad thing. तो bad और खराब चीज है, ये ऐसे याद किया जा सकता है. मार्डी कास्ट और एपिथेलियल कास्ट seen in acute tubular necrosis. That is important point. These various types of cast where is formed. So site of formation of casts in collecting duct and distal convoluted tubules of nephrons. So collecting duct or distal convoluted tubule of nephrons. Here there is two important point regarding various types of rosettes. Various types of rosettes. First, Homer Wright rosette. Homer Wright rosette. Homer Wright rosette seen in neuroblastoma and medulloblastoma. Neuroblastoma and medulloblastoma. And next is Flexner Wintersteiner rosette. Flexner Wintersteiner rosette seen in retinoblastoma. Seen in retinoblastoma. How we can remember it? In winter, fog happens and eye gets damaged. So in winter, eye gets damaged. Trick. Next, important topic like autoantibodies. Autoantibodies. So important topic, autoantibodies. First of all, anti-tissue transglutaminase, anti-tissue transglutaminase, anti-endomysial antibody seen in celiac disease. Meaning celiac disease. That is the important point. Anti-tissue transglutaminase. This is IgA. This is IgA. Seen in celiac disease. Next. Next is anti-Saccharomyces. Saccharomyces cerevisiae antibody. Seen in Crohn's disease. Seen in Crohn's disease. Next. Next, there is anti-topoisomerase. Anti-topoisomerase antibody. Anti-centromere antibody. So in case of centro, means central, it is seen in limited scleroderma. Limited scleroderma. And topoisomerase seen in diffuse scleroderma. Diffuse scleroderma. Well, anti-centromere antibody in limited scleroderma, anti-topoisomerase antibody in diffuse scleroderma. Next, anti-mitochondrial antibody. Anti-mitochondrial antibody. Seen in primary biliary cirrhosis. Primary biliary cirrhosis. Anti-mitochondrial antibody. Seen in primary biliary cirrhosis. Next, anti-Jo1 antibody. Anti-Jo1 antibody seen in dermatomyositis and polymyositis. Polymyositis. Next, anti-cyclic citrulline peptide antibody. Anti-cyclic citrulline peptide antibody for rheumatoid arthritis. Anti-cyclic citrulline peptide antibody. That's all.